We're at the IAS meeting. We're here with Deepak and Jose, who are both with UNAids, and we are going to be challenged in this interview because it's a boring subject, it's money. But we don't have enough of it, but we need to talk about that because it's an important thing for people to know that there's somebody that's watching all this, making sure that it's all done properly and save the dollars. So who wants to lead off and tell a little bit more about yourself and your function, what you actually do within the UNAids?
Perhaps I can introduce ourselves. We work together.
Right.
We have different topics that we research. We want to research money. It's interesting to know because it's one of the motors of the response. Mm-hmm. We do resource tracking, which is count how much money is available. Deepak is one of our experts in international and domestic resources. Mm-hmm. And we also estimate how much is needed and what's the best way to make the best use of that money.
Mm-hmm. And do you have anything to add to that?
Yeah, I think in addition to that, what we also do is we monitor the antiretroviral commodities, the expenditure spent in low and middle income countries, and the volumes exported by different regions.
Mm-hmm. But you don't advocate for changes on like a company should be moved from this to that or any of that, do you? You just kind of watch. You work within the framework that's already set.
You know, we do have several pieces. Of course, first we need to understand where the money is being spent, who's paying, what is being paid. Is it the best use of the money? Mm-hmm. We use the name efficiency gains. So mm-hmm. how can the same amount of money can have more impact? And we compare that against what we need. And we have some very interesting statements. For example, if we were able to have the list of the most impactful services, the ones which are cost saving, the ones which would save more lives, the ones which will avert more infections, we would say instead of spending here, we should spend there. Mm-hmm. And when we see a country cannot pay for that type of response, we say donors should supplement that. Mm-hmm. And perhaps we make an advocacy for what speed, how much. And it's a difficult question. I believe, instead of saying it's a boring issue, I believe it's fascinating. Mm-hmm. Because everybody's talking about money because we all need it, and there's not enough.
So are you feet on the ground, or are you kind of like in an office building? I'm trying to get a perspective of what you actually do, because I imagine there's a lot of footwork here to go out there and legwork, to go out and try to negotiate a better deal or to find a better product or a more suitable product for a particular population. And you're connecting with people, you're probably making all kinds of contacts with funding organizations.
There is a big team doing all the different facets of this. Mm-hmm. We specialize in doing resource tracking, we call it, yeah. And resource needs. But it's not just in a desk in Geneva. There's a lot of that. Deepak has.
But you're a piece of this work.
A big machinery.
Yeah.
So what we do is essentially to collect and analyze the information that feeds into other work.
Other workers.
For example, we connect with the countries. There are countries which do their own analysis of how much money is collected. We try to ensure that there is quality, that there is comparison, that when we're talking about the same type of variables. Mm-hmm. But there is also a couple of pieces of work. For instance, Deepak works, it's our focal point to work with the Kaiser Family Foundation to know mm-hmm. how much donor governments disperse. Mm-hmm. We have another piece of work which is countries doing national aid spending assessment, how much is being spent, if they're spending too much in vehicles and stuff. We do have another piece of work which is what are the unit costs in each country. And then we put it together and we analyze it. And then we serve other teams, a resource mobilization team, an advocacy team, a community team, the prevention team, the treatment team. So we all work together. And it's not just UNAids, not just the secretariat, it's also the different organizations, the UN organizations, which are the big UNAids, but mainly donors, universities, countries, communities.
Yeah.
Do you find that most of the players or the actors in this, the countries and the organizations are honest about this, or do you have to hold feet to the fire about being honest?
Well, when we collect data from almost 140 countries, out of which 118 are low and middle income countries, we look at not what just say reported. We look at other aspects such as how many people were on treatment in those countries, what was the population size they served. So we compare, triangulate with other sources to actually understand how good the data is. So if there is an issue in the data, we just talk to them, we get questions resolved. Yeah.
So it's, you do a lot of cost per patient per year, that type of sort of thing?
We analyze the expenditures per unit per year, yeah.
And so how do you must be doing a lot of good work, because I don't see how we can manage to make this work without you guys. I mean, you're holding this, you're really making it a solid piece of work when you say, we verified this, we verified that, this is what we know about your country, this is what we know about the expenses, and you know where you need the money. And Elton John was asking for more, and certainly yesterday was a big, started a new campaign with AIDS Fund, or AIDS Fund, I think they call it, I'm not sure, but there's a lot of work going on that is collaborating with you, but not directly out of your office. How do you do that?
Well, we track all resources for HIV from all the sources.
Doesn't matter where.
Doesn't matter where, but mostly for low and middle income countries. So we do not include the research component into this. Even though we track it, we don't publish that information. However, we have to also know that these are very important sources, the sources coming from philanthropic disbursements, but they're still small in the global AIDS response. So it was about $500 million in the global AIDS response of $220.6 billion. So the magnitude is really small, and we look forward to sources from all funding sources to actually gain more global aid spending.
How do you feel about, and I don't know, maybe there is a variation here, but you have low income, middle income, and then standard. Is there anything in between there? Because it seems like if a country moves from one to the other, there's a big shift. That's a giant step, or moves back and forth. So is there like a middle ground there of sorts? Or?
Well, indeed. For middle income countries, we divide lower middle.
A lower middle. Okay.
And upper middle income
I
countries.
got you, okay.
And yes, of course, once you have reached that threshold, which was not created for social purposes, by the way.
Right,
it was created by the World Bank
Economic.
for paying back their loans.
Right,
So we have to acknowledge that. That's why the threshold is very low. But once a country has reached the high income level, there's a cliff, because they are not eligible by many international resources. And that happens not just for HIV, it's HIV, health, education, social development, infrastructure. So that's that cliff. Once you reach that, even by $1 per capita, which might be an exchange rate issue, it might be just a temporary thing, it doesn't reflect the wealth of the country to really respond to all the needs, unfulfilled needs. It's like a person. When you just landed in a job that pays you a little bit more, that doesn't mean that you've had resources to be properly nourished, properly schooled, properly dressed, with sufficient housing overnight.
Right.
So the wealth that you invest in the human capital takes time. So we look at that. And just to add to your previous question, I believe what we do essentially is triangulation. Of course, we trust countries, of course, we trust donor governments, but we always try to triangulate. What the donor is saying is what the country received. What the country reports as a budget, is that all? Perhaps they did not spend all the budget, or perhaps they spent on HIV, but it was not part of the HIV budget. So what we do is try to triangulate it. It's some work behind the scenes. It's always to trust everybody, but to compare what everybody's saying.
Trust but verify, kind of. Yeah. One of the things that to humanize this a little bit, because we're talking about numbers and millions and billions and so forth, but when you get down to the person that's in a lower to middle income country, and they are, by virtue of their defined income or their work or whatever it is that defines them, they're really a low income person in a middle income country. And they're paying out of their own pocket for these medications, which are at a middle income price. So I've encountered this several times where there's these sad stories about people that absolutely cannot afford their medications if they want to eat, if they want to find a place to sleep, and it's pretty sad. And they really are committed to doing the right thing for their health. So these are some of the challenges that are on the ground, and reality, it's hard sometimes for some people. And I just want you to, I'm sure you're aware of this, but it's a challenge that we need to face and try to figure out more by the individual. And I guess that's the country's job to say, okay, if you can't afford, you want to be able to eat, right? You want to be able to have a place to sleep, but you should have the money yet still there to either buy the drugs or get them for very little.
Of course, I believe that's one of the virtues of UNAids. Mm-hmm. We don't just look at the pill. Mm-hmm. We don't just look at the health insurance. WHO can do that. But essentially is to have a holistic view. Mm-hmm. Look at the people. Mm-hmm. The people have competing needs. A person can live in a higher income country, but because of inequality, mm-hmm. might not be able to face or fill his or her needs, or his family or her family. Mm-hmm. So that's part of the analysis we do. For instance, just to remember, we don't focus only on reducing mortality, reducing the number of people who gets infected, but also we have some social element. Mm-hmm. We want to decrease stigma, discrimination. Mm-hmm. We just want to have social justice, bridge the gaps. Mm-hmm. So macroeconomics, macro statistics might hide many things. Mm-hmm. The average are good to understand, mm-hmm. but we need to understand the details to be able to mobilize something towards that. Yes, right, we understand the World Bank, the IMF can have the macro numbers. Right. Yes, WHO can have health insurance. But we are trying to put these pieces together with the mobilization of communities, with the need of people, with a focus on key mm-hmm. populations, the stigmatized, the marginalized, the people who don't have a voice, mm-hmm. who at the end of the day will have right.
Do you actually have people that you visit with, or does someone from UNAids sit down with some of the community and say, what are your challenges, that type of thing, on occasion?
Yes, but there are different levels. Of course, UNAIDS is a big organization. Right. We got presence in the countries. Right. We work with communities. But we have a very strong group of people who connect with communities at different levels. At the global level, here in this conference, for advocacy purposes. Right. For grassroots organizations to know what are their needs and how can they have a better response. Mm-hmm. We do connect at countries, regional, global, academia. Some of us have been contracted in UNAIDS because of having a previous work in an organization. Some others might have worked in different times in their lives here or there. Mm-hmm. So what I can say, it's part of our culture. It's mm-hmm. part of our existence that we cannot just work with the governments, even with we are the United Nations. Of course we do have to work with the governments, but not only governments. We have civil society, we have communities embedded in our system.
Mm-hmm. It's true. It all comes down to the people, though, eventually. So to include them into the mix is always important, and we really appreciate you doing that. And I appreciate the work you're doing, and certainly for the press conference, which I missed because I was doing another interview. But we appreciate the work. Thank you very much.
Thank you
for being here.
Thank you.